Hi, my name is Jennifer Sheffield, and I chose to do my career profile on an organization called Albuquerque Healthcare for the Homeless here in Albuquerque, New Mexico. My mother volunteered for this organization for many years as a therapist, in addition to her regular job, and it's something that I would be very interested in doing. Their mission statement is to provide caring and comprehensive health and integrated support services, linking people experiencing homelessness to individual and collective solutions, and to be a leader in implementing innovative service models and a catalyst for solutions to homelessness, and to uphold a commitment to diversity and equity. The working environment at Albuquerque Healthcare for the Homeless is relatively small. They employ less than 20 employees. They are run by a board, but they do also rely on volunteers to meet the needs of their clients. The working environment is generally one of working with one-on-one with individual clients or in small groups depending on the job there. They have full-time and part-time jobs with, depending on the job, somewhat flexible hours. They have many good entry-level positions, and one of the things is that even in the entry-level positions, you sometimes need some specialized knowledge that can come through volunteering before you would even graduate, so that you would be available to take these entry-level positions and have the necessary knowledge that you would need. And I found this in researching many jobs, that volunteering can get you some of the specialized skills that you need to do these jobs. This work environment also includes working in an office. Working in an art studio is one of the jobs you can do. And it often also requires you to go out and meet the clients in their environment. A person doing this job would need to love people and have a strong desire to help people and to take initiative, because some of these people have trouble helping themselves. The job offers quite a bit of autonomy, but also you need to be able to work with a team of other people, and you would need to be able to network with the community to make sure that the clients were receiving the services that they so desperately need. Typical stressors you might find in this work environment include working with homeless people who have a lot of times other issues that have led to their homelessness, or contributed at least. These sometimes include mental illness, substance abuse problems from abuse and other things that have happened in their life, and sometimes poor family relationships, although there are families who are homeless together. Sometimes clients are unreliable, and sometimes it can be hard to see them progress, although many do progress to the point where they have jobs, and some homeless people do have jobs, but also to where they are not homeless and in that situation anymore. But also working with some of these people is very long-term, and so you would have to be a person who could do that. You would need to love people, and again, be able to have healthy boundaries while you were loving them, because it can be hard to see some of the situations that these people live in. And for some people, this can be very stressful. There are lots of good benefits from working for Healthcare for the Homeless. They offer medical, dental, and vision insurance, life and disability insurance, long-term disability. They offer licensure reimbursements if you need to take a licensing test. They have 24 paid days off a year in vacation for people who are just at the starting level, 6 paid holidays, and after 2 years of working there, you are eligible to have Healthcare for the Homeless contribute to a 403B retirement account. I found 2 jobs that were entry level there. One is a family art therapist. They have a small art studio there, and their website says that art in the art studio is used as the connection for community building for those with and those without homes. This job would allow you to provide opportunities to improve social skills and have a relaxing and therapeutic opportunity for people to express themselves. You would participate in the open art studio that's open 3 times a week, and also in other outreach programs to reach homeless people. You would provide resources and referrals and complete assessments on those participating, and you would advocate for families, especially children and teens experiencing homelessness. For this, the education requirements for this are a minimum of an associate's in human services or something equivalent, which our degree would be. 1 year experience with chronic mental illness and substance abuse, the ability to create and facilitate simple art projects, and a valid New Mexico driver's license. The second job I found there was an entry-level case manager job. The case manager is responsible for helping clients to make connections with the community. Healthcare for the homeless assists them in meeting their physical, mental, and medical needs, and tries to help them find ways to move out of homelessness. This is done by connecting people to drop-in services, counseling services, referral services, medical services, and mental health services. Local travel is often required as a part of the outreach programs because, again, most homeless people struggle with transportation, and workers often must go to the client, and these services are sometimes long-term. Requirements for this job include a bachelor in social services or marriage and family studies would work for this, 2 years working experience with underserved populations, working knowledge of EHC, which is the electronic health record, and also experience with chronic mental illness and the diagnostic statistical manual. You have to have a New Mexico valid driver's license, and they would prefer someone bilingual, but you don't have to be bilingual. And some of these skills could be received through volunteering. The starting salary range for both jobs is $13.12 per hour. The art therapist would not go up much in salary from that, but the experience salary range for a case manager is $40,911 per year. This job, working for homelessness, could lead to opportunities in many other areas, including substance abuse, mental illness, Title I work, and foster care. Grant writing and fundraising are other fields that you could enter through this job. The information sources I used were the Albuquerque Healthcare for the Homeless website, Glassdoor.com for median incomes, and my mother, Mary Meeson. Thank you.